Huntington's disease, also known as HD, is a genetic disorder which one can get from their parents. It mostly affects the neurological processes in the brain. Before we start, it's important to know about the organizations and groups that support people with this disease every day through fundraisers, events, and conventions. One example, which is shown here, is the Huntington's Disease Society of America. It is sometimes referred to by its acronym HDSA. One event that the HDSA organizes every year is a fun run that raises money to treat for HD. The picture on the left shows the banner for this event. So starting off, there's a few things we need to know about how we can identify the disease in real life. The main symptoms of Huntington's disease in adults are drastic behavioral changes, abnormal and/or unusual movements, dementia, and chorea. In youths, tremor is the most significant. A few important ones to keep in mind are dementia and chorea. Dementia is a group of mental disabilities such as memory loss, decrease in visual perception, and poor cognitive skills. And chorea is a disorder in itself that yields involuntary movements of the shoulders, hips, and face. The disease is caused by an overreplication of the HTT gene. HTT, short for Huntington, is responsible for many things, but particularly the development of neurons in the brain. The mutation of the gene of the disease occurs when the HTT gene overreplicates. It is found on the top tip of the short side of the fourth chromosome. It is highlighted in the picture with the yellow arrow in the top left. Here, we can take a closer look at the mutation. In the image, we can see the trinucleotide repeat CAG. This is just a series of the base pairs cytosine, adenine, and guanine. In a healthy human, it is normal to have about 10 to 26 repeats of CAG. However, the problem occurs when an overreplication takes place. The Huntington's disease gene appears when the trinucleotide is present about 37 to 80 times. The neurons that get affected are in the basal ganglia area of one's brain. The main things it controls are movement, emotions, and one's cognitive ability. In the picture, the basal ganglia is colored in blue. Over the course of time, the HTT gene will start to corrode the basal ganglia area. We can see that here in the CT scan of the patient's brain. It is being compared with the normal brain, which is the one on the right. This pedigree shows us how the disease is passed down through generations. The HTT gene is the dominant trait and the recessive is normal. With Huntington's disease, the offspring of a parent that is affected with the disease has a 50-50 chance of getting the disease. We can see that here because one female and one male are affected with the disease, right here, and one female and one male is not affected, right here. Then we see it again with the family on the left. The offspring had a 50-50 chance of getting it, and in this case, did get affected. With the family on the right, neither of the parents had been affected, so their child will be homozygous recessive, meaning she was not affected. To get diagnosed, doctors may ask for an MRI or CT scan taken of the brain. The picture on the right is a CT scan machine. We saw an example CT scan earlier. They may also suggest genetic tests to search for the HTT gene and also may try to find any appearance of the disease in previous generations. Some people choose to take part in predictive testing, which can show whether the disease will surface later in one's life. Others decide not to because if, for example, the tests come off positive that you have HD, there's nothing that can be done about it. People with Huntington's disease have very different lifestyles than people without it. A few things different are that since people with HD have limited motor skills, without someone being there to help them, their food intake will lessen. Some cognitive and psychiatric disorders that may appear are a lack of ability to organize tasks, identify and avoid stressors, create an individual educational plan, and maintain social interactions. These things can be hard for people with HD because they might see themselves as outcasts in society. For these reasons, it's important to work with them on these skills so that patients can slow the degeneration of their brains. The prognosis of HD is that after diagnosis, the patient may live from 10 to 30 years more until the symptoms start to become fatal. Many of them, after 20 years, become bedridden and die of heart failure and pneumonia. Scientists have also noticed that the younger a person is when diagnosed, the shorter the average life expectancy. Unfortunately, there is no known treatments for HD, so any treatment that is prescribed will only slow the symptom, but will not be able to save the patient. Examples of this kind of treatments are antipsychotics for hallucinations or delusions, antidepressants for depression or obsessive compulsive behavior, tranquilizers for anxiety and chorea, and mood stabilizers for bipolar disorder. And lastly, how can we help? Well, this is a great opportunity to support those with Huntington's disease and remember those who were taken by it. So remember to wear blue and purple in May. Thanks for watching.